Let's now answer some questions on antiemetic drugs and prokinetics. Antiemetic action is produced through 5-HT4 agonist action, H1 agonist action, factor protease stimulation, D1 at antagonist action. So the answer is 5-HT4 agonist. If it is 5-HT3, it is supposed to be antagonism. For H1, it is antagonism. We don't produce antiemetic action on olfactory apparatus, but vestibular apparatus. And then D1 is not there for emesis, but D2. Ondas- Ondansetron is 5-HT3 antagonist, 5-HT2, 5-HT1, 5-HT4. So it is 5-HT3 ondansetron. The most effective antiemetic for controlling C-platin induced vomiting. C-platin is a drug. So for drug induced, specifically for those drugs that used as chemotherapy in the management of treatment of cancer, ondansetron is going to be good, which is a 5-HT3 receptor antagonist. Which of the following drugs is not used for motion sickness? Cyclizine, scopolamine, cinnarizine, metoclopramide. Remember, as we said, metoclopramide is not going to be used. It's a betamine. It's a dopamine antagonist, dopamine 2 receptor antagonist. It's not used for motion sickness, but for other causes of vomiting. Which antiemetic drug selectively block levodopa-induced vomiting without blocking its Parkinsonian activity? So domperidone, this drug has got little effect on the be- so it is a dopamine antagonist, just like metoclopramide, but then it has got little side effects, especially those that are extrapyramidal. It does not block its anti-Parkinsonian effect, so it can also work. Levodopa can still work against the symptoms of Parkinson's disease while you give this drug because it doesn't result into those side effects. A 67-year-old woman is receiving chemotherapy for metastatic ovarian cancer. She is on her fourth cycle of multiple drug regimen, including cisplatin and doxorubicin. She has developed nausea and vomiting, among other side effects. You decide to pre-medicate her with intravenous ondansetron prior to her next dose of chemotherapy and provide oral ondansetron for home use as well. What is the mechanism of action of ondansetron? What are the common side effects associated with ondansetron? As we know, ondansetron is a 5-HT3 receptor antagonist that will specifically block the function of histamine in the vomiting center. The side effects includes headache, diarrhea, dizziness, and agitation. By the way, it doesn't block histamine, it blocks serotonin in the chemoreceptor trigger zone. The histamine is the antihistamines, the H1 which ends in cyclizine, especially found in the vomiting center.